So we're going to go ahead and do an arterial blood draw. I've already come in and introduced myself to the patient, as well as taken their vitals and done an assessment. I've looked over their chart to find any pertinent information. I've also already palpated both radial arteries to find the strongest pulse and performed an Allen's test, in which I found that we did have adequate blood flow to perform this ABG draw. I've also already set out all the supplies necessary for the blood draw. And now we're ready to go ahead and do the blood draw. So I've already washed my hands and now I've applied gloves. I have already decided which wrist has the strongest radial pulse. So I'm going to go ahead and use an alcohol swab in a circular motion to clean the area, as well as to clean the fingertips so that when I palpate the pulse, we're still doing it aseptically. I went ahead and pulled back the plunger to the amount of blood that we need, and this is a pre-heparinized syringe. So I'll go ahead and remove the cap. Okay, we want to make sure that when we insert the needle, we're inserting it and we're holding it like a pencil, and we want to make sure that the beveled side is up. So I will go ahead and palpate and find the radial pulse, and then bevel side up at a 45-degree angle. I'm going to go ahead and insert the needle into the patient's wrist, into the artery. As soon as I see a flash of blood into the syringe, I know that we've gotten the artery, so I'll wait for that to fill. Once the syringe is filled, we'll go ahead and use a piece of gauze to continuously put pressure onto the area where we've just done the blood draw, and we'll dispose of the needle into a cork so that no one gets poked, and we'll go ahead and seal the sample. We're going to hold this for about 3 to 5 minutes unless otherwise stated if the patient has a coagulation disorder. Otherwise, we're going to go ahead and apply a Band-Aid. We're going to continue to monitor the patient for any swelling or excessive bleeding. And once our sample has been sealed, we're going to go ahead and just push the plunger up a little bit to remove any amount of air that could be in there. We're also going to attach our filled out label here, and we're going to put this into a biohazard bag, in which case we'll send it to the lab. So that will be going to the lab. Then, in order to take care of our sharps, we're going to take all of our sharps and put them into a sharps container so that no one can get a stick, and clean up our area. Remove our gloves. Wash your hands. Make sure that the patient is comfortable and has their call light, and that's all.